Hello, I'm a pharmacist from Sarawak General Hospital. Today, I'll be showing you how to inject Fondaparinux solution. What is Fondaparinux solution for injection? Fondaparinux is used to prevent the formation of the blood clots in blood vessels after surgery or during restricted movement due to disease. It is also used to treat the blood clots in the blood vessels of the legs or lungs. There are several doses of Fondaparinux solution available in the market. For example, as shown above. Therefore, you need to make sure you are taking Fondaparinux with the right dose to prevent any error. As the example shown, each string contains 7.5 mg of Fondaparinux in a 0.6 ml solution for injection. So how much should I inject? Fondaparinux is given by injecting into the fat layer under the skin, and it is usually given once a day. The dosage and duration of use depends on the indication and your body weight. So, you shouldn't stop using Fondaparinux without a proper medical advice. Please contact your doctor or pharmacist before stopping. If you miss a dose, then skip the dose and take the next dose. Do not double the dose if you forget to take one dose. If you have taken overdose, please go to a nearby hospital immediately for medical help. There are several possible side effects that you need to take note. First, bleeding. For example, blood in urine and stools, massive bruises, and nose bleeding. Second, allergic reactions. For example, feeling itchy on the injection site. If you are having a dental checkout or similar procedures, please inform that you are taking this medicine. Fondaparinux should be stored in a safe place with a room temperature of 15 to 25 degrees Celsius. Keep these medicines out of the reach of children. Fondaparinux syringe is divided into 4 parts. First, plunger. Second, finger grip. Third, security sleeve. And lastly, needle shield. Now, I'll be showing you how to inject the Fondaparinux solution. First, wash your hand thoroughly and ensure the expiry date has not passed. The solution is clear and colorless and does not contain particles. The syringe has not been opened or damaged. The appearance of air bubbles in the syringe is normal. You do not need to remove the air bubbles to ensure all the medicines have been injected. Sit or lie down in a comfortable position. Choose a place in the lower abdominal area, at least 5 cm below your belly button. Step 2. Clean the skin area with soap and water and dry completely with a towel before injection. The use of alcohol swabs is allowed. However, avoid use for long periods of time. Next, pull out the needle shield and discard the needle shield. Step 3. Squeeze the skin that has been cleaned gently and hold it during the entire injection period. Step 4. Insert the full length of the needle at right angles into the skin fold. Step 5. Inject all the contents of the syringe by pressing down on the plunger as far as it goes and hold it for 10 seconds. Release the plunger and the needle will automatically withdraw from the skin. And lastly, throw the syringe into a thick plastic bottle and discard the plastic bottle after it is full. It is important to rotate the injection site in the lower abdominal area for each injection, at least 2 fingers from the previous injection site.